back to my channel, and it's so good to see you. Welcome back to another installment of Ask the Doctor. We're going to be talking all about your burning questions about at-home treatments like derma-rolling, microdermabrasion, light therapy, and such. So before we get started, hit that subscribe button, share this video with somebody you think might like it, and let's do it. All right, so there is a lot of discussion, and again, you know that these questions that I've asked these experts, if you don't know who these experts are, please go back to episode 1. I'll link it below so you can see this fabulous panel of experts that I have working with me on this series. And I get a lot of questions about specifically derma-rolling. If you don't know what derma-rolling is basically it's a device that is a roller, but it has little needles that puncture the skin. It is thought to produce collagen. It's thought to create cellular repair. It's thought to, entice your skin to build new collagen. So it's going to be plumping and firming and, anti-aging and reducing wrinkles. Now, my stance on derma-rolling, as you know, I've talked about this in a few videos, is I don't recommend this for at-home use. I think it's risky. I think it can be unsafe if done incorrectly. I think it takes a lot of training to know how to do this procedure correctly. It's also a sanitary issue for me, since obviously I am all about being in a clinic. You have to be able to know how to clean that. Yes, there are multiple people on YouTube telling you how amazing it is. So please do your own research and see what's best for you when it comes to derma-rolling. But if you're asking my opinion, I recommend you go get this done in a doctor's office. All right, so let's talk about microdermabrasion. Microdermabrasion is something that is an exfoliating device. It exfoliates the skin. Usually it's used with a diamond tip. It is also something that you can really hurt your skin with when you do it at home. There was an extensive course that I took in school as well as out of school. I went to a many-day training on the proper and effective ways to do this. It is a great way in a spa setting to give you a fantastic exfoliation. It really helps reduce fine lines and wrinkles, pigmentation. It helps with pore size. It helps with overall glowing of the skin. It is something that has been around for a very long time. It is time tested. A lot of dermatologists suggest this. A lot of experts suggest using this in a dermatologist setting or a spa setting. But again, it's something that I feel that if you're going to do it at home, you really need to be trained on it. There's not very many at-home devices that are good for microdermabrasion. I have one that's sitting in my bathroom that I've used a couple of times. I use it mainly on my husband because he doesn't really do a ton of exfoliation and they have thicker skin. But for myself, I find it to be way too abrasive, and I know how to do it. So for me, it's something that could be good and it could not be good. But again, it's best done by a professional that also can assess your skin and see if that's really the treatment that you really need. And then as far as light therapy, you all know how much I wholeheartedly support light therapy at home. I have masks that I've recommended. Dr. Gross has a beautiful mask. I think it's really effective. They have different colors, and it's very effective in a whole host of things, of anti-aging, hyperpigmentation, acne, overall glowing of the skin, overall even skin texture. Now, it does depend upon the actual machine that you are going to purchase, if it is strong enough, doing the right thing. Second of all, you really have to be careful with what kind of skin type you have or where you fall on the Fitzpatrick scale, because people of a lighter skin tone can react very differently to somebody that is of deeper skin tone, even of Asian descent, that has a little bit more melanin in the skin. So again, it's not going to be something that's a fix-all at home. It's definitely something that you could have done in a dermatologist's office or a spa setting, but it is, for me, one of the safest things that you can do at home, and that will really give you added benefits to whatever you're doing in a spa setting or dermatologist setting. So, as we always do, let's hear from our experts. We're first going to start with, again, our friends from the Chemist Confession.
All right, number 4. How do you feel about the safety and the benefits of home treatments like derm rolling, microdermabrasion, and light therapy?
So we actually want to recommend derm rolling at home. Microneedles are all the rage for good reason. It has really fantastic data. It helps your serums go a long way. but the stuff you're gonna buy on Amazon for $12 are not really the right size or right
It's
depth.
gonna be a shorter.
Right, and it's kind of marketed as you know, kind of like a device almost. You keep
tool.
rolling your face with it, but the reality is the needle is probably not good over 2-3 uses
3
max.
uses. Yeah, that
Right.
needle, every time you roll, there's going to be slight damage. So, you know, it's not something to keep around long term. It does need to be replaced.
But for the most part, if you want the most benefit of a microneedle procedure,
Go to the office.
go to the office.
Yeah.
Treat yourself.
Yeah. But we should mention that we do like the light therapy devices that have come out. There is a little bit of data that shows the benefits between, for these at-home devices. And yeah, definitely a category that, yeah, we wouldn't mind trying ourselves.
Right.
Yeah.
Awesome. Those girls are so fun, aren't they? So let's hear from Dr. Stephanie Kappel out of Los Angeles. So the question that I have asked, since I did not tell you exactly, was how do you feel about the safety and benefits of at-home treatments like derma-rolling, microdermabrasion, light therapy? She says light therapy with light stem and LED light has benefits of anti-inflammatory and anti-aging. Derma-rolling is questionable for long-term effects because many of the immediate effects that occur may temporarily make wrinkles disappear from the actual swelling of the treatment, which I thought was very interesting. This is why repeated use is necessary versus a laser where one treatment with stimulating the collagen with effects will still present 1 year later. So she's saying basically when you do derma rolling, you might need to be doing this a lot more often and a lot more consistently rather than doing it with something like a laser where you'll see the effects more long term. So she says microdermabrasion has been shown to make pores appear larger, which is very interesting. Think of the vellus hair. So the vellus hair is the small peach fuzz that we have on our face. She says think of the vellus hair follicles as a triangle, where the tip of the triangle is cut off at the base. And so the tip of the triangle is cut off, so it makes the base look wider, which I think is very poignant and something that people don't understand. So when you do microdermabrasion, you actually are taking off the vellus hair, and it's done in a fashion that is pretty aggressive, and so it actually can make the pore size appear larger. So it's something to definitely take into heart. So I really appreciate her saying that. Now, Dr. Ben Johnson, so the formulator and founder of Osmosis, he says that I don't believe in frequent derma rolling or microdermabrasion because they can cause repeated wounding to the skin, which leads to less collagen and elastin being made for an aging dermis. Exfoliation is proven to increase UV damage, but it also depletes the already short supply of nutrients and dehydrates the skin. This, over time, will cause increased skin sensitization, dehydration, and accelerated aging of the skin. The idea of small wounds to increase collagen is flawed. Small wounds redirect the permanent collagen in the dermis to the temporary collagen in the epidermis, which is a recipe for accelerated aging. So if you guys don't know, Dr. Ben Johnson does not believe in any type of exfoliation. This is where it's going to be a personal choice for you. His philosophy is just as such as he has said. He does not believe in wounding the skin. He is more an approach for really adding great additives and great products to his, or ingredients to his products that are gentle and effective. But his big, huge issue is really driving home internal health. And I 100% fully agree with internal health, supporting the, the elastin and collagen production in our skin. And so that's going to be a personal choice from you. I just love hearing from him because he has such a different point of view. All right, so let's hear from Janel from Luu. So what she says is consumers need proper training and aftercare. She has seen a lot of damage due to lack of training, especially with derma rolling, because the client may not realize on a certain type on where they fall on the Fitzpatrick scale varies with the topical needle treatment. So wherever you vary, and I'll put up a definition of what Fitzpatrick scale is, but wherever you fall on that scale is where a lot of skincare experts really gauge what treatment you need. Light therapy is less of an issue, but it's important to have the client intake. So basically she's saying make sure you go and talk to your esthetician or your skincare professional and see the skin sensitivity and products the client is already using at home, and at professional salons they can determine the best treatment and protocol for at-home use. So her train of thought is to always go to a professional first to make sure they can assess out the situation. It's important for the skin to not have chronic inflammation without the proper products to decrease the inflammation. So whenever you're doing things like microdermabrasion or needling, you are causing inflammation in the skin. That's what actually Stephanie Kappel was talking about with the swelling from the actual treatments. You are causing a inflammation in the skin. You're actually hurting the skin. So that's how the body's response to injury. So that's what she is referring to. She has seen in general consumers get more hyperpigmentation and even scarring due to lack of understanding with these types of treatments. It's very important to know what the baseline of the skin is before any inflammation producing tools are used without any experience. The Asian, Hispanic, Mediterranean type of skin responds very differently, as well as lighter and darker skin pigmented responses in a different manner altogether. So again, going back to where you fall on that Fitzpatrick scale will really help you know what treatments are best for you. All right, and to round this out, we're gonna finish with our beautiful friend, Dr. Sarah Tonks, and she says, I think fill your boots. I just love her. I think she is so fun. I think fill your boots. I have a few patients who do home derma-rolling and have done it for years, and their skin looks very good. Not sure if you can effectively do microdermabrasion at home. I can imagine it would be a bit messy. I think light therapy is good to do at home. The important thing here is that any home use device, of course, won't be as effective as one used in a clinic, but it is also not likely to be harmful either. It can be a good way to carve out some self-care in your day. So I love her approach. She is definitely one that supports at-home use, but again, I think it goes back to what she's saying, which is knowing that it won't be as effective as what you do in a clinic, which we do know that. They all have professional grade tools, which is what they should. And I think it also comes back to what she says, which is, training, of course, and making sure, you know your baseline. So I hope that this helps you on this whole subject, this very confusing subject of derma-rolling. I think they've all given you a great wide range of suggestions and recommendations when it comes to these at-home treatments. I really appreciate y'all loving this series. It has been so much fun for me. I have so much more coming up. This is basically going to be a 9-part series, and we're only on part 3. So I am very excited to do this more for you. Please comment below. Let me know your experiences with any of these at-home treatments, if they've worked for you, if they haven't. Have you gotten them done in a doctor's office? Have they been effective? Always love to hear from my squad members down in the comment section. All right, everybody, I love you, and I'll see you on the next one. Lots of love from me to you. Bye, loves.